morning guys, my name is Akanksha and welcome back to Nexus Medical Media. I'm really so sorry because we are joining again very late, but I hope it's gonna worth your time. So what we have discussed till far, that was about ventricular septal defect, and I think almost everything is covered here, but what exactly do we need to know now? Let's talk about that. So we have to talk here about the surgical treatment, right? That is what I have promised you last time, that what is gonna be the surgical treatment for our ventricular septal defect. But before that, is it required for all the ventricular defect or is it just required for some few? So this is what I have to tell you. If this is a small one, and I have already taught you about it, what could be small, large and moderate size. So if it is a small one, then there is no requirement of any surgery, any conservative treatment. Within some time it can get away with itself, so no requirement at all. Then moving on, what if it is a large or moderate one? What we gonna do at that time? So let's talk about it. Firstly, we will start with your conservative treatment. Okay, so what we're gonna start here is we're gonna try to apply some conservative treatment. What we will find in conservative treatment, let's see, and please follow up. So let's see what you can give. Okay, so the first thing we can give is your diuretics. What are few names of diuretics, if I might ask you here? So like one I'm gonna give you, that is furosemide. Then most of the time people, they do not tell us about the dosage. Like every time everybody is confused, what are the doses? And please, you can keep on writing down with me, then it becomes easier for you. So the usual dose that we're gonna give here, it would be 1 to 3 mg per kg per day. Okay, so this is how we give the dosage. And how many doses per day? So that too you should write. It can be either 2 to 3 doses. Okay. What are the importance of giving a diuretics? Can somebody tell me here that what would be the importance of giving a diuretics? So we can say that it is helpful in renal damage. What else? It can also be used into electrolyte imbalance. Okay, so this is the first thing. What next can we use? What is the another thing that we can use here? So this is the first one. Then after it, please do write down with me. The next thing that you can give is, that is your ACE inhibitors. Everyone has been talking about that. So ACE inhibitor. What are these ACE inhibitors that we can give? And can we just give them in VSD, or are there another disease that they can be useful? So please do write and keep in your head as well that the ACE inhibitors, which is your captopril, they can be used in systematic or as well as pulmonary pressure. So do you see a little figure I have drawn for you, and I think it is like upside down. I don't know why it is upside down, but okay, let it be. So but yeah, from here you can remember that this is left to right shunt. Okay, so when I'm talking about a ACE inhibitor, then these are specifically useful in all those diseases which are from left to right, and we have already talked about shunts. What another doses we can give? The another and the last dose that I wanna have you written in your copy is that your, yes, every one of you is right here, and I think this was the first drug that came in your mind, but yeah, we have written it at the last. So now, what are the doses you're gonna give? This is I wanna ask you here. So the dosages from 5 to 10. So this is how you give the treatment for your VSTs. But yeah, we also do have a surgical closure, and I'm gonna upload that video later on. So you have to tell me if you are really interested into the surgical closure previews of VST, or is there someone who wanna know about the complication, because what are the complications that we finally come across with? So the first complication, it would be your right bundle branch block. Okay, so this is the complication, and it is caused when you are gonna have a ventriculotomy. Okay, so it can actually have a direct injury on your ventricles. So this is what, or to your right bundle, this is what we have to initiate with. So this is the first complication that comes to our head. It's your right bundle branch block. So please put a star mark here. It is very important and it has been asked in our exams as well. So this is what we can use. Now we have to take care of pregnant women because they are special care as well. So what should we do in our labor, delivery? These are some few cautions that we will talk into the further topics. So for today on, thank you very much for being sticking with me, and I'm very happy that we have finally covered VST. Let's see some picture from VST management, that what we have written, is it correct or not. So you can even notice in this picture which I have just obtained. So observation and follow up, it's for small VST. If you are gonna give some medical treatment, then it is, we will give either diuretics, and if it's ACE, then we will give them, yes, exactly, so we will give them RA and PA pressures. And surgical, if it is, then it will be your large VSTs. So I hope you enjoyed my class today, and please keep on joining with us, and please do keep sharing, and be happy, be healthy, and please subscribe to our channel, which is Nexus Medical Media. Thank you so much for your time. Please join with me again.